Esta mesa, mientras tanto, os la presento, está formada por el grupo de trabajo formado por diferentes países que se ha creado para abordar los desafíos que enfrentan los pacientes con osteoartritis. Podremos conocer cómo se aborda este tema desde el punto de vista de esta coalición de organizaciones de pacientes que cuenta con expertos de Francia, Italia, Portugal, Austria, Países Bajos y la Liga Panamericana de Asociaciones de Reumatología, APMARR, que, como sabéis, integra las sociedades científicas y agrupaciones de pacientes reumáticos de todos los países de América. En la mesa no faltará, por supuesto, el doctor Vergés, presidente de OAFI, que lidera esta iniciativa, y Nina Martínez, responsable del departamento I+D de OAFI, que también se encargará de moderar la mesa. Ladies and gentlemen, distinguished guests and members of our esteemed audience, it is with great pleasure that I stand before you today to introduce a remarkable group of individuals who have come together with a shared dedication to improving the lives of those affected by osteoarthritis. This collaborative effort is embodied in the formation of the OA Patients Task Force. This coalition of patient organizations was founded 7 years ago because patients must be united if we are to advance in the same direction. So please, allow me to introduce the key figures behind this initiative. Our first guest is Dr. Vergés, who serves as the president and CEO of the OAFI Foundation, the organization that leads this initiative. Next, we have Françoise Alliot, the president of AFLAR, the organization dedicated to advancing the cause of rheumatology across France. Ms. Elsa Frazão, the president of LPCDR, the organization that supports patients with osteoarthritis and other musculoskeletal disorders in Portugal. Then we have Andrea Tomasini from APMARR, an organization that has been a driving force in advocating for OA patients in Italy. Next, Dr. Maritza Quintero, the vice president of the OA group within APMARR, brings her medical expertise and dedication to the table. Lastly, we have Corné Battenburg, the president of Reuma Netherlands, the organization dedicated to advancing the cause of rheumatology across the Netherlands. These remarkable individuals, each with their unique experiences and contributions, have come together to form the OA Patients Task Force. They share a common goal to address the challenges faced by osteoarthritis patients and drive positive change. Since we would like to learn more about past achievements and future objectives of the EA Patients Task Force, Nina Martínez, head of the R&D department of OAFI, is going to explain to us a little bit about what is the task force and which organizations participate. Thank you, Nina.
Thank you, Txe. Bueno, buenos días a todos. Muchas gracias por estar aquí. Good morning to everyone, and for being here. So before going to the panel discussion with the different organizations, I would like to explain what is the task force and which countries participate. So first of all, the task force is an alliance between the most important association of patients with OA and other rheumatologic problems in order to work together globally. As you can see here, we have the Arthritis Foundation, that is the organization for the United States, AFLAR, that we have here the president, Françoise, from France. Then we have APMARR, that is a aggregation of patient organization for 21 countries in America. Then we have Liga Portuguesa Contra as Doenças Reumáticas, which Elsa will be here with us. Then we have the Foundation of Arthros from Belgium. Then Reuma Netherlands from the Netherlands, and APMARR, that we have here Andrea Tomasini with us to explain a little bit the actions of his organization. And this year we have the incorporation of two new patient organization, the one from Germany, that is the Arthros Competence, and the Arthros Forum from Austria. As you can see here, we represent more or less 150 million of patients worldwide. So which are our objectives? First of all, to create awareness and also to promote education. For us, it's really important that society really understand the difficulties, for example, the patient have, and also to really understand this illness that, as we mentioned in the first presentation, it's really associated with elderly, and sometimes we don't do too much stuff about it. Also, we advocate for the patient rights. For example, as Dr. Vergés explained, OAFI fight for the reimbursement of a treatment for the benefit of the patients. Of course, enhancing the quality of life. We are really focusing in this point because, as you see, these patients has really bad quality of life. So for us, it's really important to improve it. Also, we advocate with health policy makers to change this reality. And of course, we do this research and development on osteoarthritis. As you know, it's really, we don't have enough, I think. And we collaborate globally for these objectives. Some of the action that the group has been made, first of all, was a systematic review about the quality of life of patients with knee OA. In this review, we saw that these patients has really, really, really bad quality of life, and also that not too many articles are really addressing this point. And this review helped us to conduct a survey in 6 countries around the world, that is the GOAPS, the Global Osteoarthritis Patient Perception Survey. And we have really interesting results. For example, that most of the patients have hypertension and also obesity. During this Congress, we have 2 tables speaking about these other conditions. So I invite you to learn more about the management when you have other illness. And also that the 43% of the patients want more education and information about the disease. This is one of the objectives, I think, of all organizations, to promote and inform all the patients about how they can manage better their condition. Also, in this survey, we saw that pain and stiffness are the most common symptoms in these people. Another action that we recently do is we join together to celebrate the World Osteoarthritis Day. It's not an official day, but we saw that we have a day that celebrates the rheumatic diseases, that is the 12th of October, but we didn't have a World OA Day, and our next task is to make it official. So we all join together and make this awareness in the 27th of September. And now I'm going to start with the panel discussion.
One issue only is to recordar para las personas que no entienden el inglés que hay dijéramos, traductores, se pueden, lo digo más que nada porque si hay alguien que no entiende el inglés, hay traductores fuera que pueden ir a, ¿dónde está María Teresa? Abajo en la entrada, y para poder entender perfectamente si no entienden inglés. Lo digo más que nada porque, igual que la mesa que viene detrás, lo digo, los que entiendan inglés, pues fantástico, de los que no se preocupen, que bajen abajo, que tendrán, hay una traducción que se hace, ¿no? ¿Vale? Y después también comentar, perdona Irina que te he interrumpido, no que todo esto que estamos haciendo, aquí todo esto se va a colgar en el canal YouTube de OAFI, todo, las mesas. El año pasado por el Congreso pasaron 200.000 personas, lo digo porque esto, si tenéis familiares o conocidos que realmente pues, no puedan venir, pues que pueden ver todo esto, va a estar colgado en el canal YouTube. It's only say that everything will be put in the YouTube channel. For the people that are not here, they can see, and that's all. Perdona, Nina.
No, it's okay. We will upload the videos in Spanish and in English. So to continue and to start with the panel discussion, so we know that pain is a daily challenge for individuals with osteoarthritis, and it profoundly affects their lives. So understanding the significance of pain is crucial, I think, for us. And could you share a little bit which strategies and experience you have in this regard? So first, for example, Maritza, that you are near.
Bueno, muchas gracias. En nombre de la Liga Panamericana de Reumatología, que integra 21 países de América, incluidos Estados Unidos y Canadá, y que abarca aproximadamente más de 1.000 millones de habitantes. Un saludo para OAFI, su CEO y fundador, el doctor Josep Vergés, con quien trabajamos desde la mano ya hace varios años. Y lo más importante que tenemos que dejar claro en esta audiencia es que el propósito de la Liga Panamericana, desde el grupo de artrosis, es darle visibilidad a la artrosis. Cuando Josep presentaba hace unos minutos los programas, pues de verdad que son símiles. Nosotros tenemos desde el inicio una programación de congreso de pacientes, o sea, precongreso, el congreso de APMARR se celebra cada año, y precongreso hay el congreso de pacientes. Cada vez cobra más auge, con una gran audiencia, pero lo que es más importante es que esa experiencia se replica en los 21 países que integran APMARR. Yo creo que el éxito de esto es poder tener acceso a darle información y empoderamiento al paciente. Y lo importante es las alianzas estratégicas que hemos establecido en aras de que, como lo decía la presentadora, darle calidad de vida al paciente, frenar el dolor, no detenerlo, y que el paciente con artrosis no se sienta un enfermo más.
Thank you, Maritza.
Sí.
And Françoise, AFLAR, for example, what is doing to improve the symptoms of these patients?
Thank you, Nina. I'm very happy to be here with you, with Josep Vergés at the International Congress of OAFI, and with friends from all countries in Europe and in America Latina. AFLAR Patient Association is a public utility in France, and we represent 20 million of patients suffering from all rheumatism, and especially, of course, osteoarthritis and osteoporosis too. We work with patients, for patients, and by patients, and also with health professionals and governments to produce progress and actions against osteoarthritis. And we work with the supervisory authorities too on subjects such as the shortage of medicines and the treatments with health authority. And just a word on osteoarthritis. Arthritis is a painful and serious disease. We have heard Josep and you, Nina. And in France, misconceptions circulate, like there is nothing to do. It's an old person's disease. You have to live with your pain. And I don't have much to offer you. We do think we have to work hard to change this, of course. Also, we think that we have to work also for diagnosis. at the first signs of illness, pain in particular joint, it's essential to have a diagnosis as soon as possible, as early as possible, to treat and slow down, because we have heard it's possible to slow down its progression by giving the patients the means to be treated and to treat themselves by physical activity, by good nutrition and Tai Chi, we will see this afternoon. I deplore the lack of innovation, but we have heard molecular and collagen, the lack of innovation in the management in France and its treatments, in the management. We do think there is, however, a combination of pharmacological and non-pharmacological treatments and with a personalized approach. That's the key. So,
totally agree.
Yeah.
Totally agree.
Yeah, we have a lot of work in France.
Yeah, and in every country, I think.
Yes, yes.
Yeah.
That's the reason why we work with OAFI in Spain and with all countries.
Okay, so Dr. Vergés, could you explain a little bit what we do?
Yeah, I completely agree with you, Françoise, completely agree. Pain is, as I mentioned before, is the most important problem. Patients go to us because they have pain. This is a chronic pain, and the perception is very bad. And yes, as you mentioned also, it's important when the patient goes to the sanitary system, that sometimes the sanitary system don't take care about that, because the doctor is very occupied, and also
and pain affects 9 patients on 10.
Exactly.
And fatigue, of course, and interferes the sleep of 68 of patients, the impact on social life, family life of 62%, and the expectation and demand of patients is to regain quality of life, primarily by relieving their pain. And the pain, we know, prevents movement and provoke kinesiophobia, fear of movement.
That's the problem. What we can do about that, no? And what we are doing in Spain, no? That could be maybe useful and work with, and in fact, yesterday when we spoke together, more or less, it was the same. What we can do first, the most important is to inform to the patient. I mean, patient, for us, it's very important that they will know very well their disease. Now it's a new area, okay? Information is very important. Second, for example, in activities, as we will do this afternoon, no? Some activities like Tai Chi or walk, and explain that even you have pain, you must move. This is a very important issue, because sometimes I have pain, I don't move. If you don't move, it's worse. That means that you must move even you have pain. Of course, that is very important, go to the doctor and to use some analgesic in order to reduce the pain. No? All the programs that we are doing, as I mentioned before, the OAFI woman, the OAFI, for example, veterans, the OAFI, with you, all the programs, we spoke about how we can improve the pain, the mentality of the patient to improve the pain. Sometimes we need psychological, support, because in order that to change the mentality, as you mentioned, to change the mentality that I have pain, but I would not change my life. This is very important. I will not change my life. I will go to buy the journal. I will go to the restaurant. I will go to the, to be, to big shopping, etc. I mean, never the opposite, because if not, you have a depression, you have anxiety. That means another important issue that we are doing is our TV program, because in the TV program, other patients, they can, make their experience to others, how we improve it, no? I mean, the experience of the same patient to other patient is very important, no? Because they know exactly what the problem you have, because I have this problem before, no? We are doing a lot of activities. Clinical trials, the most important in the clinical trials is pain, you know, and also to discuss with the societies, medical societies, how the doctors could be, you know, to talk with the patients and how can we improve it, etc., etc. I mean, there are a lot of things that we can do, a lot of things. And I think this is more or less how we can do in OAFI, no? And the clinical solidarity, the same. Sometimes we arrive to ask people that they have depression, anxiety, insomnia. Even sometimes we receive people that try to commit suicide in OAFI. And we have a special plan when we receive a patient that they would like to commit a suicide because they feel very bad. In this moment, we take this patient and we started to work with her or with him to try to help, because there are people that could be commit suicide because for the pain, because all the pain all the day, you know, it's very bad. The same in France.
The same in France.
That means that, and of course there is a treatment available. No, there are analgesics. You know, if you have a lot of pain, you can take some drugs, that tramadol or fentanyl. I mean, the doctors, they know it. They have drugs that they can use it, because you cannot have all the life with pain. That means that you need, in this case, the support from the medical, you know, physiotherapists, etc. No?
Totally agree. And in Portugal, which experience and which strategies are you doing?
Tienes razón, Josep.
I think the problem in Portugal is very similar to what we've been hearing from our colleagues and from other countries. In fact, in Portugal, knee osteoarthritis, hand osteoarthritis, and hip osteoarthritis altogether represent 24%. They are prevalent in 24% of the population. It's the second most prevalent rheumatic and musculoskeletal condition in Portugal. And in Portugal, we are talking about having like 52% of the population having at least one of these conditions, of one rheumatological condition. So we have a high number. And of course, we felt in our organization, the Portuguese League represents all rheumatic diseases, but since 2011, we felt the need to establish a patient group dedicated to OA, to osteoarthritis. And since then, there are several actions we have been taking. I will explain a bit later. But I think the most essential work to do is to raise awareness, so that the general population knows about OA and how to seek for early diagnosis and early intervention. Because early intervention, if you have a pharmacological treatment or non-pharmacological treatment or both at the right time, it will improve the quality of life. And this is one of the aims, is to improve the quality of life of people affected by these conditions, allow them to have their normal life and normal family life. So this is one of the trends. And of course, we also try to promote access to exercise programs and rehabilitation too, because physiotherapy and rehabilitation are essential also for the patients. And of course, we try to also to stimulate and participate in research related with OA. And by the way, when we're addressing pain, we also, I think since 2014, we have a patient group for pain also in our organization, and we try to work together. So really across all things. So they promote sessions on raising awareness. They address this issue on the cycle of pain that we were talking about. You have pain, then you get depressed, then you don't feel, if you have pain and you're depressed, you don't exercise, you reduce your activity, and then the pain increases, and it's very difficult to break this cycle. So this is something that both patient groups try to work together in our organization.
Really interesting, really. Thank you, Elsa. And Andrea, what strategies are doing in Italy in your organization?
When we received the key questions, we read in first question, we have to understand the significance of this pain. And I want to tell you that our strategy is based on develop a specific point of view. The point of view is a cognitive and conceptual position from which you can create your narrative. That means not only disease. You know, in English there are 3 words to say disease or clinical condition. Disease, that is how medical science define a condition. Illness is how a person is living a condition. And sickness is how society is building up the disease. And we try to bridge these 3 dimensions. And I think pain is not only a physical one. There is a social dimension through which the body, the self, that is a subject and at the same time an object. Because when you feel pain, you are subject that are negotiating with an object. Once again, we are trying to bridge the individual dimension to social dimension. Pain is coming from frailty, vulnerability, social network. It's important to try to build up a strategy that includes not only a person, but the social dimension of health. This is, in our opinion, the key tool that COVID epidemic gave us. And we collect narratives in order to understand and to find and to set up a situated knowledge. Situated knowledge is a knowledge that is from a different part of people living in the same condition that produce strategy in the daily life. And we try to understand and define and spread this kind of dimension. Daily life and quality of life, obviously, is the key topic in which we are focused in our activity. And we try to produce knowledge. Before you mention, or somebody mentioned, expert patient. When you say expert, there is inside expertise, that means study, but also experience. And we try to produce through this situated knowledge evidence, according, for instance, with the opportunity that NICE in UK tell, or promoting PPI, collected studies that are, since the beginning, people living with the condition in the process. Only, I think, through these collecting narratives, we understand that the concept of chronic ill is going to change, because chronic is based on the concept of natural history of a disease. Now, for many reasons, that includes early diagnosis and psychological intervention, drugs, or care strategies, natural history of a story of disease is still not a good concept to define chronic condition, because chronic condition now is a condition in which every day people living with a condition have to negotiate time, space, therapy, partners, leisure, everything.
Yeah. Thank you, Andrea. And the next question that I want to ask you is about function. More or less, are in your organization, what are you doing to improve the function of these patients? Are you doing some activities with patients, workshops? So please, in a short answer, if it is possible, could you first, Maritza, explain us what is AFLAR doing to enhance this
Desde
function?
AFLAR tenemos programas muy interesantes direccionados en la escuela de pacientes, con un manejo multidisciplinario, que se manejan a través de un coaching médico y vemos todo el conjunto, porque para llegar a la función articular hay que ver primero las condiciones de este paciente, su entorno, verlo como de manera integral, como una unidad biopsicosocial. Muchas veces indicamos un tratamiento y el paciente no tiene los recursos para comprarlo, o es una persona que vive sola y no tiene cómo desplazarse, o tiene problemas laborales. Entonces lo vemos en todo su entorno. Y este es un proyecto que está bastante avanzado en varios países, lo de la escuela de pacientes, incluso ya se está trabajando a un mediano plazo en la universidad de pacientes. Todo el objetivo es darle toda la información útil, como comentaban los colegas, en el tratamiento farmacológico, no farmacológico, ver el paciente en el todo, desde cómo entra, cómo pisa, cómo se moviliza, cómo está su marcha, si tiene una sobrecarga ponderal, cómo son los problemas de nutrición.
Súper interesante.
En el todo. Entonces, bueno, yo pienso que este programa va a ser un programa que va a dar mucho éxito en los resultados del tratamiento de los pacientes con artrosis, porque es global, es un enfoque distinto.
Que se focaliza en la persona, it focuses on the person.
O sea, no se trata nada más de dar un tratamiento y medidas desde su inicio, de dieta, ejercicio, cómo se moviliza, cómo mejorar la función, cómo proteger la parte articular, sino preservar la salud articular. ¿Sí? Y sobre todo, pues lo que decían los colegas, tomar en cuenta también la parte farmacológica, darle calidad de vida al paciente. Nuestro lema es calidad de vida y la artrosis hoy día es una gran esperanza.
Sí. Thank you, Maritza. Françoise, in AFLAR, which type of activities or workshops maybe you are doing to enhance this function in the,
yes, Nina.
the patients?
I think it's very important to inform patients first and to propose to patients to organize and to manage themselves the non-pharmacological treatment in alliance with pharmacological treatment. And I think the patient can then control his treatment as with self-care, and he is autonomous in his management of osteoarthritis pain, and I think it's essential. And we have to develop information, of course, with health professionals, pharmacists, and nurses, of course, and physiotherapists. And because contrary to popular belief, there are many ways to be treated and to treat yourself, patients, yourself, with self-care. And that this is not enough known. Of course, a final word for healthcare professionals. As you know, I have said, we work together, patient and scientific experts. And a fundamental priority is to underline the urgency of progress and better communication on the therapeutic means, of course, as say Josep, available to better manage disabling pain in osteoarthritis. And we must emphasize the importance of bringing osteoarthritis to the forefront, given the urgency of the situation. In France, we have 12 million of patients suffering from osteoarthritis. And in España, you have a lot, in America Latina también. And to finally bring about chances, fight against prejudices, disseminate information to patients, but also to the doctor pharmacists and physiotherapists and nurses, as I said. It's
Totally
very
agree,
important.
Françoise.
They have a role to play in offering, of course, therapeutic arsenal to the treatment, to the patient. With self-program, I insist, is very, very important.
Since
Yeah,
we are,
el dolor no nos frena.
el dolor no nos
Es
frena.
importante de decirlo y repetirlo, y repetirlo. Muchas gracias.
Since,
Tu español es muy bueno,
Me
Françoise.
gusta mucho hablar con todas las personas.
since we are like a short enough time, could you please
Gracias,
explain in
Marisas.
1 minute what are you doing, Dr. Vergés, Elsa,
Yeah.
and Andrea, to enhance
Yeah.
functionality?
Yeah, I think it's very important function. We must teach, to our patients, explain very well with time. We make also, focus group sometimes in order to see if we are teaching well to them. And patients say, you are teaching well, I understand. This is very important because we could use the technique. And as you mentioned very well, and Maritza and you, is that, for example, during this Congress, you will see a table, because we are now working with health authorities in Catalonia, in Madrid, in Andalusia, in the country Basque, in order that OAFI, as a patient, the doctor can do the diagnostic and the treatment, but the patients can teach to other patients. That means the health authorities can use to us, exactly, with videos, with technique. It's very easy to do it.
Yeah.
You will see during
Yeah, is the next table, no, the next one?
this one. You
Yeah.
will see exactly how
During
can
this morning.
works very well, because the doctor doesn't have time to explain how you can reduce weight, how you can walk, how you can sleep, what kind of shoes you must take it, etc. But we can do it that. That means the doctor, please follow with that, and this is better. I think it's
Yeah.
could be good.
And Elsa?
Yes, in Portugal, we have, in our organization, we work a lot in collaboration with other entities. And for instance, we have this program, which is called Pleno in Portuguese. And it translates something like Free Program of Education and Exercise in OA, which is developed in articulation with the Faculty of Human Kinetics of the University of Lisbon. So it's a community program addressing self-management, of course, and education on exercise, so that patients can afterwards have their exercise done in an autonomous way on their time and at their home. And we have in collaboration with the faculty, and it was before, last year, it was in primary care units, so we try to go where patients are. And for 23, 24, it will be provided in the faculty and in parish centers. So to try to go into the community. It's a 3 to 6 or 9 months, depending on this is one of our activities. We sometimes also deliver some mindfulness programs, also to help to deal, because function and pain, they are connected.
Yeah.
And if you feel pain, and I think we have already addressed the cycle of pain, so it goes together. We have, in 2021, we had a dedicated webinar on OA, addressing all these issues, and it's available online. And in 2022, last year, around the World OA Day, we released a newsletter only dedicated to OA. It's 2,000 printed paper versions that are distributed nationally, and it's also available online for download. We had also a collaboration with the Faculty of Science, with IT students, that developed a web-based platform. It's called NOAA. It's Narrative OA Approach. We had it's a kind of, it has a virtual assistant, it's interactive, and also uses gamification. It was a pilot. We were not able to develop the whole 4 levels, and we stopped precisely just before we were not able to develop this yet. The exercise programs and the non-pharmacological approaches. And I think this is a very important area we should work on to improve function, of course.
Of course.
That is the most
Thank
of it.
you, Elsa. And finally, Andrea.
I'll try to be very fast. We have obviously dedicated webinar. We perform every year a patient school through which we inform and we train our people. We produce online postural gymnastic courses, yoga courses. And we have also realized, together with the University of Reggio Emilia and the Italian Society of Nutrition, a recipe book that was the finalist in the Digital Award last year. And we were the only patients organization. But the focus of this book is not related how to eat in a medical, let's say, or therapeutical way, but how to eat in order to maintain network with your own health, doing for yourself, including people that can eat together with you. So it's good recipes for everybody, but taught in consideration of rheumatic condition. The last one I want to tell you, movement and limitation means a rupture in dealing with the world. So we try to understand how people with a rheumatic condition are living at home. So we performed a questionnaire in order to understand how house is organized. Because house is a way through which you organize your intimacy, but it's the place you invite people to be together. Once again, relational dimension of health and movement and space are key dimensions of this, are our focus.
Thank you, Andrea. As you can see, all the organizations have a lot of programs, workshops, and strategies to improve functionality and also to manage correctly the pain that osteoarthritis patients have. So we are honored to receive some videos since some of our colleagues from the other organizations cannot be here. So first of all, I want to present you the Arthritis Foundation. The president, Steven Tyler, has sent us a video with some of the conclusions and also answering the questions that I already did to our participants. So please, the video of the Arthritis Foundation, I think. Oh, yeah.
Greetings. I'm Steve Taylor, President and CEO of the Arthritis Foundation, and I want to send my well wishes to all of you at OAFI this week in Barcelona. Sorry I can't be there in person, but I send my regards to Josep, all of my patient organization colleagues, and of course, all of the attendees there that are going to be talking about very important issues regarding osteoarthritis and how it affects patients. Here in the United States, 30 million patients have osteoarthritis. This is a staggering number, and the Arthritis Foundation is committed to making a difference for all of those patients. From our work on Capitol Hill in Washington, D.C. to pass laws to help patients be able to have the life that they want to have by being able to have access to healthcare providers and treatments, it's critical that these laws get passed. Also, our patient education programs to help patients understand their options from treatment to surgery and how important it is for them to be advocates for their own healthcare. And then, of course, this year, 2023, we have invested over $5 million in osteoarthritis research here in the U.S. We're honored by our work in osteoarthritis, the amazing collaborators between the rheumatologists and the orthopedists. We have committed such a great investment in osteoarthritis, and we've made such a difference, and we look forward to the future, working with all of you, working with OAFI, and working with our volunteer healthcare providers to changing the lives for osteoarthritis patients. As you know, osteoarthritis is disabling. It causes pain. It causes a lack of independence. And most importantly, it takes away their quality of life. So together, all of us, you, us at the Arthritis Foundation, we can work together to make a difference in the future.
Thank you so much for the Arthritis Foundation and their president, Steven Tyler, for sharing their valuable insights about this session. Also, our colleague from Austria, Barbara Egger-Spiess, sorry, I don't know German, has sent us a video sharing her view about this presentation also. So let's see about Barbara.
Hello to the Osteoarthritis Patient World Congress from Austria. I'm Barbara Egger-Spiess and I'm the founder of the Arthrose Forum Austria. This is the Austrian Osteoarthritis Patient Organization. We are a private organization. In fact, pain is a challenge for many osteoarthritis patients. Depending on the state of health, there are often additional circumstances, such as too little exercise and being overweight. What we can advise is that those affected should pay attention to osteoarthritis self-management. We see exercise and nutrition as the cornerstones of osteoarthritis self-management. This means that patients should keep moving despite pain, of course with exercise programs and therapies in consultation with the treating doctors and therapists. At the same time, patients should pay attention to an anti-inflammatory diet, and if indicated, also to weight management. Naturally, it makes it sense to take pain medication for a short period or have infiltrations. In any case, our priority is always to exhaust the conservative options. However, we must be realistic, I think, because when all possibilities have been exhausted and the suffering of those who are affected is great, joint replacement is often the result. We see osteoarthritis self-management as the most important strategy for coping with the pain and delaying or even avoiding joint replacement surgery. At the question of quality of life of osteoarthritis patients, I want to repeat myself. Our osteoarthritis patient organization has the clear focus on the osteoarthritis self-management. The strategy behind we call the flower therapy. What does this mean? This means that we are individuals. We are different. We have different pain. We have different osteoarthritis. We need different measures and treatments. And so you go out and take the different measures and the different treatments like a big, colorful bouquet of flowers. And however, this requires information, education, motivation, and as patient organization, we support this. We have in our digital self-help group, we discuss all these niches. We organize self-help meetings, and we have events like osteoarthritis information days. And in November, we're starting a new format. There we will have a self-meeting, a classic self-meeting, but there will also be an expert. The next meeting, there will be an expert, an orthopedic expert, and another time there will be a physiotherapist or another expert. So this is a new format we try the next time. And we found also the osteoarthritis holidays together with Austrian hotel group. There can the patients see what means osteoarthritis self-management and try medical therapies. What is the role of our patient organizations? I think it's a very important one. We have campaigning for the topic of osteoarthritis in Austria since 2015. We have an osteoarthritis blog, we have an osteoarthritis platform for sufferers and a support group. We see that the health policy and the health system recognize that osteoarthritis self-management is important and that osteoarthritis is a big concern. We think patient organization will play an even more important role in the future. Osteoarthritis has already reaching epidemic proportions. Nearly 600 million people worldwide are concerned. So the health systems have to react to this and find answers. And I think we can support this.
Thank you, Barbara. And last but not least, we have some college from the APMARR. We have Miguel Albanés, that is the president, and also Oscar Rillo, that is the president of the osteoarthritis group. So let's hear about them.
Hola, la artrosis, una de las enfermedades más prevalentes dentro de la reumatología actual y que gran discapacidad y dolor ponen en nuestros pacientes, es motivo de un estudio largo aliento y grandes inversiones de tiempo y valores en nuestra reumatología de hoy día. Es por ese motivo que quiero saludar el 7º Congreso OAFI, valorando sus innovaciones, valorando sus aportes, convirtiéndolos en líderes de opinión y mostrando lo que vamos a ver en los próximos inmediatos en el tema de la artrosis. Saludo a Josep Vergés, saludo a Marisa Quintero, dos amigos e importantes líderes de opinión en el campo de la artrosis en el mundo y sobre todo para Iberoamérica. Y desde APMARR les deseo el mejor de los éxitos en este congreso. Gracias por mantener un tema tan importante como la artrosis al día. Gracias por la innovación. Lo mejor para estos congresos. Abrazos desde APMARR.
Hola a todos, soy el doctor Oscar Rillo, médico reumatólogo de Buenos Aires, Argentina, y coordinador del grupo Osteoartritis APMARR. Nuestro grupo colabora con la Fundación Internacional de Artrosis, OAFI, y su director, el doctor Josep Vergés, en tareas académicas y de empoderamiento para nuestros pacientes con artrosis. En esta ocasión, quiero invitarlos a participar del 7º Congreso Internacional de Pacientes con Artrosis, que coincide con el 23º Congreso de OAFI. Tendrá lugar los días 25, 26 y 27 de octubre del corriente año en Barcelona, España. Este congreso tiene un lema: el dolor no nos frena, es decir, podemos disfrutar de nuestra vida aún padeciendo artrosis. Habrá conferencias, clases magistrales y talleres prácticos dictados por los más destacados ponentes en relación a las enfermedades osteoarticulomusculares. Además, se han programado actividades recreativas y culturales para todos los asistentes. Así que los esperamos en Barcelona los días 25, 26 y 27 de octubre del corriente año para desarrollar el 7º Congreso Internacional de Pacientes y 23 Congreso de OAFI.
Okay, thank you to Miguel and Oscar. Now we have some minutes for some questions. So, si tenéis alguna pregunta, la podéis hacer también en castellano, aunque la mesa haya sido en inglés. A ver. Sí, mira, por allá al fondo. In the back. ¿No? Allá.
Hola, bon dia. Agraeixo moltíssim tota la tasca que fan aquests doctors i tot
el task force.
OAFI, perquè vull dir, en el moment en què tenim problemes de salut i d'artrosi i complicacions, doncs tenim a on agafar-nos i a on demanar consell.
Muchas gracias. Un comentario.
She say that he's very happy with OAFI, that we can support to them with this kind of problems. No? Moltes gràcies a vostè per vindre. Molt agraït pel comentari. Thank you very much for your comments. We appreciate.
And the last one?
Good morning. I'm Gudla Petersen from Grüntal, and Grüntal is a company specialized in innovative pain treatments, specifically also in osteoarthritis. First of all, congratulations to this program. It's really great that you bring the people together from the different organizations. And I was really impressed also about Elsa's initiative, having a dedicated group in your organization in LPCDR on OA and connected with pain. So my question to you is, what can other organizations learn from you? Because we see that the rheumatology associations are very powerful and very professional, but most of them are more focusing on inflammatory diseases than on osteoarthritis. And if I may ask a second question, it's also to the others. Early diagnosis is really key, and I've spoken to many people who are really frustrated because they are young, they are not believed by their doctors. What can be really done to empower them, but also to educate healthcare professionals to be really identified and better helped?
Thank you so much, Gudula. So, please.
I'll try to answer very shortly. I think it's very important for an organization, when you are an umbrella organization, to build your team and to bring the people, the coordinators, let's say, of these groups together. Because usually it's very easy to work separate, even if you are under the same organization. And I think that was the better way to try to put them together to work. When we have every year we develop a meeting, in-person meeting, with the coordinators of our groups and the active persons in our organizations, so they can exchange and know each other and exchange and plan activities together. And I think this makes the difference, and it's not easy sometimes in umbrella organizations to try and work like this. And also addressing now the second question. For instance, we have this web-based platform with gamification. It's a pilot, like I said, but the intention was to raise awareness on the early symptoms and even to get a younger audience, because we need to have these younger people also aware that there could the symptoms could be of OA, and we also need to work with doctors, but that will be a long, another session. Thank you.
Thank you, Elsa. Yes, Dr. Vergés.
Yes, only say that for us, you know, I appreciate that you stay here, you know, and I think it's very important that this activity that we are doing, that the patients working together, no, and to change information to what is doing in Portugal, what is doing in Italy, or in the United States, or in Venezuela, or in France, or in these countries. I think this is a very important initiative. Yesterday, we spoke from different projects, and more or less, we can represent 200 million of people with OA. That means that this is very important, because this is the view of the patients, no? Our view, how we feel, how, you know, and this is a very important issue, because we can change the perception, we can change, even the health authorities can change that to understand better that we are patients with suffer a lot, and this is, I think, a way to do it. That's the reason that it's very important to continue to work the group, you know, and now, yesterday we see the German people that they stay with us. I mean, other countries, they are, you know, putting together in order that to make, you know, publications to speak about quality of life, to explain to health authorities that it's very important to invest and to knowledge about that. And I think this is a very important issue. We are very happy that we are working together. I think this is a little bit...
Yes, I do think it's very important because in group, in activity with group, it's possible to discuss, to explain, to communicate. And it is essential.
Thank you, Françoise.
Yes, it is useful. It is very useful for patients. What is not useful? It's not useful to hear from a doctor or health professional, move, lose weight. It's not useful. Patients need concrete discussion, concrete information,
Correct.
and concrete encouragement. Yes.
I agree.
So,
yes.
Thank you all for being here and for sharing with all the audience your expertise and your insights about this theme. And please, we can give you an applause to them and continue. Thank you.